Hello, my name is Amy Snowden, and this presentation is for NSC 890. The title of my paper and presentation is An Integrated Review of the Effects of Cognitive Behavioral Therapy on Adolescent Depression. Now, according to the National Institute of Mental Health, there's an estimated 2.1 million U.S. adolescents in the 12 to 17 age range who had at least one major depressive episode with severe impairment in 2015. Now, depression contributes to many issues for adolescents. These include physical conditions, missed school days, which impacts academic performance, substance abuse, high-risk behaviors, suicide, and when left untreated, is a leading cause of disability. Now, according to Healthy People 2020, one of the objectives is to reduce the proportion of adolescents who experience major depressive episodes to 7.5%. Now, in 2014, the national baseline was 11.4%. Now, in Kentucky, which is the state where I reside and practice, that number is 8.7%. So I think that data indicates that there is certainly work to be done both at the state and national level to reach that Healthy People 2020 goal. Now, the two studies that I did, I'll present those next. The first one was a 2014 study in the Journal of Abnormal Child Psychology, and it was a randomized controlled trial testing the effectiveness of a depression prevention program among adolescent girls with elevated depression. This study had 102 Dutch adolescent girls in the 11 to 15 years old range. The experimental group with CBT, there were 50 participants, and in the control group without the CBT, there were 52 participants. To measure the static depressive symptoms, they used the Child Depression Inventory, and the CESD was used to measure the more fluctuating depressive symptoms. This study showed that there was a decrease in depressive symptoms for girls in the experimental group versus the control group, and this was seen both during and after the intervention. The second study was a 2012 study in the Pacific Rim International Journal of Nursing Research, and it looked at another school-based cognitive behavioral therapy intervention for Thai adolescents with depressive symptoms. And this one conducted a quasi-experimental study which had both quantitative and qualitative evaluations. This one used 70 Thai students from two different high schools. In the experimental group with CBT, there were 35 participants, and in the control group with usual care, there were also 35. The intervention used the social cognitive learning theory. The CESD was utilized in this study to measure depressive symptoms, and this one also looked at negative automatic thoughts and used the CATS measurement, and then looked at social and adaptive role functioning as well. The findings in this particular study show that there was a reduced depressive symptoms, decrease in negative automatic thoughts, and an increase in social and adaptive functioning. Qualitative findings were much the same, but they also showed an improvement in relationships, and the participants reported being more mindful about their schoolwork. Now, overall, this study suggested that CBT is timely, and that they also recommended that school nurses would need to be trained in order to effectively implement this program. They also suggested more parental involvement. But overall, with both studies, CBT was found to be an effective school-based intervention for adolescents with depression, and that there were positive outcomes and participant satisfaction. Both studies provided some insight for improved nursing practice, especially in the area of mental health nursing. There is a need for school-based therapy to provide CBT for adolescents. Now, in applying this specifically for advanced practice, psychiatric mental health nurse practitioners would be considered ideal candidates to serve in this position to provide depression screenings in school systems, CBT sessions. Also, when you would expand that to look at medication evaluation and management, safety assessments, and other services that could be provided. I went ahead and added some benefits of a school-based CBT program by a psychiatric mental health nurse practitioner. And some of those would include to offer individual and group counseling, promote collaboration with teachers, with ancillary services that the student might receive and families. The student would remain at school, which would decrease the amount of missed school days. An in-school program would improve access to care, would also foster compliance with treatment, and as the studies have shown, it offers a personalized evidence-based treatment for depression. And when you look at further discussion for a CBT program in school settings, you could look at an on-site psychiatric mental health nurse practitioner or by utilizing telehealth services. So I certainly think those are some areas to be discussed further. Thanks for watching.